Good afternoon to everyone. My name is Melissa Bishop Murphy. I'm the co-chair of the Multicultural Health Equity Collective for Pfizer. I was very happy. I was actually supposed to moderate another session, and then when I saw the political determinants of health, I said, oh, I want to moderate this session. So the session is entitled Political Determinants of Health, How Community-Based Organizations Can Advance Social Commitments to Equity. So before we get into the questions, if our panelists would introduce themselves and provide, one or two bits of wisdom about your organization and what you do. We'll start with Miss Jacqueline. Sorry, Jacqueline. Burton.
Thank you. You call me Jackie.
Will do.
Good afternoon. I'm Jackie Burton. I serve as the president of the Conference of National Black Churches. CNBC is our acronym. CNBC is an organization that is comprised of the leadership of the 6 largest historically black denominations in the country. For those of you who are not African American, I'm going to give you the long names of the denominations. That's African Methodist Episcopal, AME. African Methodist Episcopal Zion, that's AME Zion. Christian Methodist Episcopal, that's CME, the Church of God in Christ, COGIC is what they're called, the Progressive National Baptist Convention, and the National Baptist Convention USA, Inc. These 6 denominations represent about 20 million people and 30,000 churches. Our purpose is primarily to come together as denominations because we can do far more together than we can do separately. And we primarily consider ourselves the social justice voice of our member denominations. We represent about 80% of African Americans in this country. CNBC has been around for maybe 40 years. It began actually, the first part of my career, I served as the Director of Black Religion at the Lilly Endowment, the largest funder of religion and philanthropy, and I was there when CNBC was founded. I'd like to say maybe I was 10 then, but that would be a lie. So actually, yeah, I'm the only living founder remaining. So I'm grateful to carry on the torch and the work, and the organization is doing tremendous work, particularly in the area of health equity. We see health equity as a social justice issue.
Thank you.
We work with 41 urban Indian health clinics. These are Native-led organizations that are by Native people, for Native people, providing health care throughout the United States. And we are also focused on health equity and ensuring that all Native people have access to health care no matter where they reside.
Kenneth.
Thank
National
you, Melissa.
Hispanic Caucus of State Legislators. And Kenneth is also a member of Pfizer's Multicultural Advisory Council and has been so since the inception.
Thank you. So great to be here. Thank you for the invitation. So I'm the Executive Director of the National Hispanic Caucus of State Legislators. We're headquartered in D.C., representing the interests of over 450 state legislators, including 5 right here in Oklahoma. And we do, the work that we do, we carry out by educating legislators on a wide array of issues that go beyond those that are stereotypically, shall we say, associated with Hispanics, because at the end of the day, legislators are legislating on everything, right? So we carry out our mission by providing conferences throughout the year where we have these discussions on all of these policy areas. We also take positions on many things, many issues that impact Hispanics and communities of color and other underserved communities. And so once we do that, we do a lot of advocacy work with Congress, with the White House administration. We also work with our sister organizations that are part of what we call the Quad Caucus. So the National Black Caucus of State Legislators, the National Asian Pacific Islander Caucus of State Legislators, and the National Council for Caucus for Native American State Legislators.
One of the co-conveners.
Yes, and yes, exactly. So I want to give a special shout out to my good friend and my colleague Martha Saenz, who leads that effort, and I want to also congratulate Pfizer for making sure that this convening is particularly shedding a light on the needs of the Native community. So we really, really congratulate you for that.
Well, thank you so much, and Martha, thank you for all that you've done to make this conference a success. If you'll stand up and be recognized. Thank you.
She's my partner in good trouble, necessary trouble.
Yes, absolutely. Jim Warne.
Thank you so much. Washteelo Tashunka Akanhwachakte is my Lakota name. Jimmy is my American name, so you can stick with Jimmy if you prefer. I'm here representing the University of South Dakota Center for Disabilities Oyate Circle, which Oyate in my language means the people. And we're a subdivision of our Center for Disabilities at the School of Medicine that focuses on indigenous needs for disabilities. Something that's a reality for us and people of color is that we have higher disability rates. And the unfortunate reality as an instructor, often I'll tell my students at the beginning of the course is in healthcare and academic statistics, when you review American Indian outcomes, assume the worst, and you'll get an A. Now, what a horrible thing for me as an Oglala to have to state that and have it to be true, to have the highest rate of disability, the lowest death rate. It's amazing what we go through in Indian country regarding healthcare disparities, as well as our death rates. The average in South Dakota for Indian men is 58 years old. On my reservation in South Dakota, Pine Ridge, for men is 47 years old. So those are some realities that we're living with that they would call third world issues. And that's something that my brother very eloquently states with Doctors Without Borders, is you don't have to fly anywhere. You just have to go over there. Because many of our communities have significant challenges with healthcare, those challenges and lack of. And I wanted to do this with policy and the political aspects because of Congress is not following through with their promises. And quite honestly, Congress is ignorant by design because they have been products of American education. So by design, you're not supposed to know who I am. Because think about what you learned in school about us. All of us did the pilgrim hats and the feathers, correct? How much more do you remember?
The Trail of Tears, Jim.
Hey, all right. So your instructor taught that. That's good. So when you hear Holocaust, do you think Europe or America? Who had a more successful rate of genocide? America. So that's a reality when we look at, the Greek genos, decide, Latin, genocide, to describe what a Polish gentleman did, a survivor of the European Holocaust, implemented that word genocide, which applies to the American experience. So with these healthcare disparities, my mom's a nurse. She just made her journey. My hair's short right now because we cut our hair when we lose a loved one. So those memories go with them as they make their journey. And in my mom's honor, who fought for her whole life just to be who she was, and a successful nurse at a time when we weren't included, is very important to me. I had some slides that I was too late to share, but if you go, I just created a website this morning, jimwarne.com. So my slides are on there for a few days anyway. Now I have a new website to design. But it does identify the political realities of what we're dealing with Indian Health Service. The Supreme Court cases were 3-1 in the past 2 sessions. And those are some of the realities of Indian country, is we always have to fight to the highest level just for basic self-determination and access.
Well, first of all, Jim, our condolences on the passing of your mom. Yes, for sure. So we're going to start with you, Jackie. The first question is around community-based organizations. You know, they are restricted from lobbying. So how can they have an impact on healthcare policy?
Well, obviously speak in the context of the Black churches. The Black church is the strongest institution in the entire community. Even during COVID, as our churches had to close, we never stopped worshiping. Our churches only closed historically for weather, for snow. I'm a preacher's kid, a PK. I was born in a parsonage. Another one here. And I was practically born on a pew. My mother went into labor while she was sitting in the sanctuary in Washington, D.C. So I came out of that experience. And my first position was at the Lilly Endowment, a philanthropic foundation. I didn't even know what a foundation was, literally. But I was kind of cherry-picked, and I went there. And they were very interested in religion, and that is how I became interested professionally in advancing the work of the Black church, which I have done throughout my career. In terms of lobbying, if we want to get a message out to legislators, to policymakers, we talk to our constituents. We are strong voices. We're trusted voices. We're trusted messengers. We have trusted spaces. And when our pastors, when our leaders speak, people listen. People listen. And we've always been the center of the Black community. I can remember growing up, I would wonder why my parents would always answer the phone all the time. And Daddy says, well, you know, people are in need. We have to answer the phone. He said, I can't be absent. I can't just decide this is not a day that I want to be bothered. And I can remember my mother, he would wake up in the morning, he said, Jackie, where is your mother? She would get up at 5 and 6 o'clock in the morning. She was not a trained nurse, but she was taking care of people, going to this home and going to that home and taking food and changing beds and doing what she could. So I grew up in that kind of atmosphere. And also, another thing I often say about the Black church is that we are the largest philanthropy in our communities. I'm a product of Black philanthropy. Why? Because we lived, my father was a full-time pastor, so we lived based on the offerings that were given. But when we want to give a message, when we want to spread the word, we do it through our pastors. So our legislators listen to us. I think someone said today in one of the earlier panels, don't just show up at the church if you're a policymaker. When when it's election time, don't come talk to us then. Let us know you all the time. So with op-eds, with radio and television, and so many of us have television ministries now. That's really we're the best messengers that you can have if you're going to talk about policy.
Perfect. Thank you so much. You certainly touch on the fact that you all are trusted voices for the community. So thank you for that. Kenneth, from a policy perspective, what can lawmakers do to achieve community-specific health equity?
I appreciate the question because oftentimes when we're talking about this, we're talking about social determinants of health, right? But with 11 days, 10 hours,
Oh my
0
goodness.
minutes,
Do you have a
and
clock where you're
6
counting down?
seconds to go, we have to talk about political determinants of health and realize that a lot of the outcomes that we see in our communities have nothing to do with our DNA, has nothing to do with whether or not we have access to healthy foods, has nothing to do with whether we have to travel an hour or not to see a doctor. It has to do with who is sitting in the state capitol. Right? So And there's a lot that can be done. I think, it's important for legislators, and this is something that we have been working on in our caucus, to make sure that there is greater participation, for example, of Hispanics in clinical trials, that there is extended coverage for medications for, in certain diseases that particularly impact our communities. And I'll mention one that is very important, and that is establishing regional health equity coalitions, right? And we use a model that was proposed originally in Oregon. And why do we do that? Because we think it's important that these coalitions are really community-based. They're community-driven. It's community organizations that understand the needs of the community, right? They're there. They can also see it from a holistic way, right? It's that there's issues like transportation, education, jobs, right, that have an impact, right? And so I think it is a great model. They understand where the need is and how it needs to be provided. And so they also establish a bridge between community and policymakers, which I think is very important, right, to realize. So there is a great connection there. So I really think that, you should look at regional health equity coalitions in your state as a great.
Thank you for that. Might I add also to connect with your own legislator, right? Absolutely know who your House member is, your Senate member is, and certainly get involved with organizations like the National Hispanic Caucus of State Legislators.
Yeah, and educate, right? To your point, in terms of, I know that CBOs cannot do lobbying, but that doesn't prevent them from doing advocacy, right?
Exactly.
And that means educating, like, this is what's happening in my community.
Telling the story.
You need to understand what's happening, and you need to address. Maybe you're not calling for a specific vote on a specific bill, right, which is the part that starts getting into lobbying, but you have a role to play in educating them to get these policymakers to make the right decision, right, and not wait till the last minute when that bill is on the floor, to do that.
Thank you so much. Meredith, given their different perspectives represented on this panel, are there any differences on how community-based organizations can engage on the local, state, federal level?
Yes, I think, everyone has said this, but telling your story is important no matter who you're talking to. And that's, there's a saying, all politics is local. It starts at the very, very local levels. So whether it's talking to your city council or talking to your senator, but every single person you can engage with is an opportunity. And I worked on Capitol Hill for a long time, and what we are looking for is opportunities for the members of Congress to go into the community. They want to hear from you, and they want to hear what you need. So you don't always need to know the bill or the legislation or the complex policy issue. You're there to tell them the great work that you're doing on the ground, that it's community driven, and what do you need from the government. And at every level, they can help you, and that is their job. And it's your job to remind them that it's their job. And so whatever way you can do that is impactful. So when we go into meetings with Capitol Hill, what I do is I have my staff research how many Native Americans live in their congressional district. And then I have them look up how many votes did they win by in the last election. And every election is getting closer and closer. It's just days away. But we need to remind people that these are communities, and these are a block of voters, and these are people that they need to care about, whether they think they do or not. But you're telling them why that's important. And I think always driving that message home of what your community is doing, what your organization is doing, and the great work that you're able to do. You're connecting the dots for them in a way they don't always see the full picture. And I think that really helps them get to the policy piece. Once someone has seen your face, it's a lot harder to say no to them. And I've been in a lot of congressional meetings, and the more people come in and get to know their legislators, the more the relationship builds and the more you're able to advance the policies, because it all comes back to the fact that we're all human beings and we all need to start to see each other that way. And if you can get the lawmaker that you think absolutely will say no to everything, keep going, keep visiting them. Don't stop calling. Don't stop inviting them. eventually they're going to come, and maybe that will be the difference that gets your policy advanced. So I just say, make them show up and hold them to it.
Meredith, you make a great point, because you shouldn't be going to a legislator when there's an issue. You should always be engaging with that legislator and educating him or her about what you're doing. To that point, Jim, how can community-based organizations amplify the patient voice to be part of the conversation?
Ah, yes, and it is the voice and storytelling that needs to be done, because that's the humanistic element that we all have as two-leggeds, as human beings, is how do we share those stories, and those stories impact people even at the legislative level. So it is key, as has been mentioned, is we must be participatory. Now, in Indian country, it's difficult, because we're constantly dealing with a government that is breaking their promises, that are breaking treaties with us, but not with other countries. So they've broken every treaty with us. So we're dealing with a Congress that, again, is ignorant by design. And 30 senators represent 15 states that effectively eliminated the tribal nations during the 400-year war. So that's 30 senators that have zero incentive to vote for indigenous issues. So that's quite a battle when we have 30 senators that are not motivated to support us, and that's where the storytelling and the humanistic aspects must come in. So when we have our storytellers, and in this case, as a filmmaker, I'm always recording our elders so they can tell their story in English or their own language so that it can be shared and documented, and then get it into a format that may educate some of these congressional members, because they've been educated by the American system. So, but by design, once again, they're not supposed to know who we are. And sovereignty. As tribal nations, they mistakenly call us minorities. We are not minorities. We are members of tribal nations that have sovereign rights in the United States. And thank goodness we're mentioned 3 times in the Constitution. That's why in the Supreme Court, we tend to win many of those battles, because we always are fighting with the lower level governments who are denying, and then the federal governments ultimately deny. Then we go to the Supreme Court and then force them to work with us. So it's an interesting dynamic to have the Indian Self-Determination Act in the 70s. Just so that we as human beings, as tribal members, can be self-determined to make decisions of our own. Similar to people with disabilities had to get a Self-Determination Act, just so they could make decisions on their own. So there's a connect and intersect with the both cultures that I specialize in, working in the disability culture, as well as with my indigenous brothers and sisters. Now, we've been fighting the U.S. government for over 500 years. We're not in the Department of War anymore. We're in the Interior. But when I go and testify before Congress, they've already heard it from us. We need you, our non-Indian allies. If they hear it from you, then they will start listening more, because they hear it from us constantly. And they
Coalition
haven't moved.
building, coalitions.
Yes. And that's when we build that partnership, so we have that coalition and are able to access some of those basic services that we're not getting access now. Indian Health Service is funded at 63% capacity. 63%. What's going to be the outcome for my family members that rely on that healthcare system? It'll be a D- in healthcare. That's why we have the highest death rate. That's why we have all these issues that Americans seemingly don't care about or are not aware of. So next time you're on the Hill advocating, end off with, oh yeah, and follow through with the treaties, would you? You know, just a basic human right. You know, when our tribal colleges are funded at $7 billion and the need is $55 billion. So it's amazing how much they'll be able to do that. And I'm so happy for the HBCUs getting $17 billion last year. Wonderful news. You have 4 medical schools. Again, wonderful news. How many are graduates of HBCUs out there? Yes.
Yeah, yes.
How many tribal colleges? So that's a reality.
Right.
Tribal colleges are funded at about 1/3 the amount of HBCUs. So imagine how you're underfunded. Imagine taking away 60% of your HBCU funding right now. What would happen? So those are the challenges that we face as Indigenous people in a country where we seem to be forgotten. So please be allies. Please work with us. We can't do this alone. We need our fellow Oyate, our fellow people, to join us in that advocacy.
Thank you, Jim, for that call to action. Shifting gears, Kenneth, we want to talk a little bit about specific policies. Can you talk about existing models that need reform to help improve health equity?
340B.
Talk to, for those who don't know 340B.
Sure. So 340B, okay. So 340, you may be very familiar, but just to give you some context. So it was enacted into law in 1992. And basically the purpose, good intention, right, was to provide relief for folks, right, to have access to medication at lower cost, right, and have these entities, hospitals namely, purchasing medication at a discounted rate, oftentimes upwards of 50%, right, so that folks could have access to medication. And so the intention was very good. And the first 13 years, we saw very slow growth. There were about 583 entities that were covered, right? That was for the first 13 years. And then all of a sudden, we see a boom, right? So now there's 2,600 entities that are covered. You see massive hospital consolidations happening because of this, trying to use the 340B program for financial gains. That's creating care deserts. It's increasing costs for folks, and all of this without the initial intent of being able to take those savings and reinvesting them in the communities to have better quality care, more access, providing care, for example, in places where perhaps there were no facilities, right? And so we see that happening. We see also that over 60% of medication that is through the 340B program is not going to the intended patients. It's to patients that do not qualify under 340B. So that's an area that really needs to be looked at. General Accountability Office has issued a report in 2023, scathing report on this, and it really needs to be rehauled, because at the end of the day, right now, 340B is benefiting hospitals. Let's be honest. It is not benefiting the patients that need it the most. So I would say that needs special attention.
Another call to action.
Another call to action, yes.
Moving to you, Jackie, would you talk a little bit about how can CBO leaders elevate their voices to have an impact on statewide policy? So you talked to us a little bit about the community, the Black churches being the heart of the community. Can you talk to us how that they can take that to the level of state-based policies?
With CNBC, as we are top down in terms of our voices, we look at the national level, which is denominational leaders, but then we all have jurisdictional leaders, like a district that you could think of, and then also we have state level. So you have state Baptist conventions, you have state Methodist conventions. So that way you go through the state level. So we have someone at every tier. Okay. We have every tier of the leadership ladder. And I think that when we galvanize, we're really, really strong.
You are also working in coalition with other community-based organizations.
We do. In fact, CNBC just received an award from the Robert Wood Johnson Foundation, where we'll be working with community-based organizations to really strengthen our voice. So it's not enough just to hear from the preacher, but enough to hear from our partners at UNIDOS and other organizations. So yes, we do.
about the local communities and the advisory panels. How can community-based organizations get engaged with those local committees, advisory panels, whose work is to improve health equity outcomes for local communities?
Thank you for the question. I have to recognize that Robin Sunday is in the room here, and she runs the Oklahoma City Indian Clinic. She is a pillar of the community and an example that these organizations are providing exceptional health care, and they are doing it with limited resources, but they are creative and they are doing innovative things with creative partnerships. They are finding private foundations to work with and the local community. And it's not alienating between different communities. It's about having native and non-native organizations working together and local, all the way up to federal level. But having those conversations and being in those rooms is what's been able to help them provide transformational health care. So not every single community is struggling. A lot are thriving and doing incredible, amazing work with a little more help from private companies like Pfizer investing back. The federal government alone is not going to solve this problem.
It's all of our problem. Right?
Exactly. So that means talking to your community advisory panels. When I go to these coalitions and meetings, the first thing I say is I look at the list of people and I say, you don't have any Native organizations on here. And if that's not on the list of membership and your community or coalition group is about health equity, then you're failing. And so that's
to Jim's point.
Exactly. And so, I mean, you can't say that you're doing health equity or health justice work and not have all representation there. And so, you know, like you said, non-native allies as well are needed. And it's my job to hold, you know, the people who aren't standing up to what they're supposed to be doing accountable and make sure that the people who need to be at the table are at the table.
So before we open it to Q&A, could each of you provide one action item you think members in the room should take? Jim, we'll start with you.
I like action.
Yes.
Well, there's something I'm looking at with my presentation here is the resources when you think of Medicaid, Veterans, Medicare, Bureau of Prisons, healthcare, per patient cost, and then Indian Health Services at the bottom. So one thing we can do significantly, which is pitiful in reality, is if the federal government funds Indian Health Service equal to the prisons, we will double Indian health care. And that will still be less than half of Medicare and Medicaid. So if their goal is to make sure that we're still underfunded, they can still meet the goal. But if they fund us equal to prisoners, and I have family in prison, and they get double the health care than my family on the res. So one action item is fund us equal to prisoners, and you will double our health care. And thank you, Urban Indian Health, because I use First Avenue in San Diego. So good dentistry over there, and my grandkids use it. And it's necessary to have the Urban Indian Health Centers for us urban Indians. But then the forgotten group are the ones back home on the res. And those are the folks that are really, every day back home there's a young one attempting suicide. Every day. And fortunately not all of them are successful, but it's a reality that we have as the highest rate of suicide with our young ones, including some of my family members. So that's something that none of us, depending if we're urban or res or fiscally there, it still impacts us with that intergenerational trauma. And I manifest my trauma by writing grants and making films. So
Wonderful. Kenneth?
I would say probably ensuring activation and renewals in Medicaid. I think, you know, just like when you go to the DMV to get your driver's license and you get asked, would you like to vote, right? Any interaction that a person has with government should include, hey, would you like to be considered for possible eligibility to Medicaid, right? because there are a lot of people that are lost, fall through the cracks because they don't even know that they're eligible, right? And so this could be done through, state legislative action.
Thank you. Meredith?
Well, I think those are both great examples. I think, as we look ahead, the election is coming up, but it's important to remember that there are elections every single year. And you need to vote at every level, and we hear about it every 4 years, but people need to vote every election and learn about their local and state, because those people are making policies too, and those are right in your backyard. So we need to remember to remind people that their civic engagement is a right that they have earned and that they need to exercise. And so that would be my final piece.
I would echo my sister here, because certainly, and we're very involved in a Get Out the Vote initiative now. And what do you say? How many days? 12?
11 days.
11 days. I want to know exactly. Yeah.
11 days, 9 hours, 38 minutes, and 17 seconds.
There you have it. There you have it. I don't.
Who's
think,
counting?
Is there anything more powerful than the power to vote? And each one of us has to do that. We're doing it through our churches. One thing, if you would allow me to say this, an initiative that all of us, I think, can embrace is the initiative around the need to help those who are unhoused. And we believe that the entire community has to do that. We would like to see churches become centers of worship and wholeness. In other words, let's get the homeless folks, and let's get those who are unhoused to come to our churches and be able to what? Take a shower, do their laundry, get a meal, see a doctor, see a psychiatrist, see a dentist, and be able to talk to a counselor. Because it seems that if we really rally around that one thing, that we could all benefit, our communities would benefit. We wouldn't be trying to throw people back somewhere so they couldn't be seen when we have a public event coming. So I believe that if we can grasp the need and the urgency of ministry to our unhoused, that we will build greater communities.
Well, let's give our panelists a hand. So we'll take questions now. Yes. I'm going to bring you the mic.
And the solution that you have is very fair, to have a benchmark, which is per capita spending for IHS at the prisoners level, which is very, it's fair and it's minimum actually. But the question for you is how to make it happen. The reason I'm asking is that 20 years ago, there was a Native American senator, Ben Campbell. Yes. So he sponsored a entitlement spending bill for IHS to make that spending to be entitlement mandatory, and he failed for 2 times, and both of his bills, none of them received any votes in both Senate and the House. So it's very painful. 20 years later, we have not seen anyone who sponsored that at all. That's one. The second is that the Biden administration in fiscal year 2024, he proposed in his president budget, proposed to have non-entitlement mandatory spending for IHS. However, it was not approved by Congress. And this year, fiscal year 2025, he proposed that again, and we don't know what the result is. So my question for you is, how? You have a vision and you know what the benchmark is. What is your strategy to actually make it happen? How?
Again, it's allies, coalitions. We need to have our non-Indian brothers and sisters also share the message, because we've been sharing it for generations, and it's not happening. So they are willing to break their promises and treaties, and they're just fine with it. But if they hear from you and identify that, wow, there's non-Indians that care about Indians suddenly, What's going on with Indians? Because in most cases, just like Biden did the executive order 14112, I got a lot of contracts because all these federal agencies are going, oh, geez, what are we doing with Indians? So now they're scrambling to go, where's an Indian? So that's what we're dealing with constantly in D.C. And they're breaking their own promises. And it was great to have Nighthorse in Congress to put those out there. We need more of us in Congress, obviously. But we just got the first American Indian to run the Bureau of Indian Affairs in history under the Biden administration. So yes, and Deb, she's doing the best she can to correct 500 years of wrong. And so we need another multi-generations. Nixon was actually the best president for Indian people. Too bad he was a naughty boy, right? But for Indian people, he saw us differently. And then as a former, football player, his football coach happened to be a tribal member. So he saw us as a coach, as a mentor, as a leader. He didn't see us as a problem. So he tried to get an Indian in as the head of the Interior for the first time, but it took till now to finally get a Native person in there. So that would be the person I'd go to because they have an access to the White House. And working with Deb Haaland and her team of Native people for the first time in D.C. ever, which is pitiful, but common for us. So that's a reality. So those baby steps are happening. So I'm starting to see some of those things happen. As a grandfather, I won't see it fully implemented, but my grandchildren will. I'm a firm believer that this next generation, the 7th generation philosophy of Black Elk, it's been 7 generations since Wounded Knee. And now I see a difference in you towards us. So our non-Indian allies, once again, you are essential for my grandchildren to have a better life and opportunity to gain access to health care than many of my family members on Pine Ridge Reservation right now. It's unfortunate my family members in prison have better health care. So what's the message? If you want better health care as a Native, commit a federal crime. So then you get double the health care. Isn't it terrible I have to say that? Isn't it terrible that that is a reality? And that's something that I want changed. And as a grandfather, I really want it changed for my Takojas, my grandchildren. They need to have a better world and to be identified in a country that wants to forget. So that won't happen with this next generation, with your allyship. Palamia, watch Dalo.
Thank you, thank you, thank you. So stand, sorry. I'm being told to stand. I just want to talk about the use of public data in policymaking and hear from you sort of like your approach to strategizing on how there's just more inclusivity of data in policymaking. So there's been a couple examples stated here that aren't actually mandated to be publicly recorded, including the experiences of homelessness. The other part, people don't realize my kind of Indian didn't exist on the U.S. Census till 2010. And so all of a sudden, there were millions of South Asian Indians in the U.S. It wasn't because we were born overnight. It's because there was a checkbox we could select. So I'm just wondering, advocacy that can be done to advocate for like carceral rates to be publicly reported. Because, in my field in mental health, a lot of folks don't go in with a mental health diagnosis, get access to mental health care in a carceral facility, and then leave with no access to mental health care. And there's no record sort of that's publicly available of how many folks are getting those diagnoses or what kind of care they receive. And so on the community side, it's really hard to track and break the cycle. So strategies to work with legislators to better understand the value of catching the rates of unhoused. Some of the folks talked about carceral facilities, but also not only just our identification as like people, but the social determinants themselves are also not being mandated to be recorded, which creates a huge issue. And I'll just plug a report we did at Morehouse School of Medicine on the economic burden of mental health inequities a couple years ago. and we were to capture how many lives and how many dollars we could save, we made our mental health care system more accessible to people of color, and it was $287 billion. But that didn't include active military, the incarcerated, people who are homeless, people who are living in nursing homes, and young people, because there was no requirement publicly available to capture en masse enough of a data sample to include that. So $287 billion is actually probably like 20 times that amount. And so when legislators who don't buy into this hear that, they're like, wow, that's a lot of money. It's gross to attach human life to that, but sometimes you have to create those pathways. So I'd just love to hear how you advocate for better data practices.
Sure. I mean, one thing that we are always calling for is disaggregated data on everything that we do, but the thing is that Hispanic legislators, whether it be Hispanic, Black, Native American, or API legislators, they get it. It's the rest of the Capitol that doesn't get it, right? So we need to do a better job in educating legislators. The other thing that we do internally is, like, if you go to any of our resolutions, you can go to our website. We are a very data-driven organization. You know this, Melissa. Like, there's no policy that we're advocating for that is not based on science and data, right? And so, and we want to make sure that we're sharing that data with folks to educate them on it. Sure. So yeah. So we have a resolution process where we take positions on a wide array of issues that go just beyond Hispanic issues that we call, or stereotypically associate with Hispanics, rather. But we also make sure that we're tackling some of the most challenging issues. So it's not just about, resolution approving Mother's Day, because everybody's in favor of Mother's Day, right? It's tackling some of the more difficult issues, right? And once we take a position on that, right, and it's democratically voted, and so just like in any legislative initiative, right, in their capital, right, once it's voted on, then it provides the caucus with the platform to do the advocacy needed. And then the other thing that we do is we also push for legislation at the state level. So just to give you an example, this year we're having our summit coming up in Denver now in November, and we're going to be putting together a legislative compendium so that if you're, say, a newly elected legislator, that perhaps we're, let's say, an educator, and so you know a lot about education, but there's so many other areas that perhaps you're not familiar with, but you want to champion bills on, we are putting together legislation that other legislators have already introduced in their states that moves the needle in that topic, but it comes with the seal of approval of our caucus because we already have a resolution that advocates for that specific policy solution. So it comes with a double seal of approval from the caucus and from the fact that it was a fellow legislator of color that championed that bill in another state. So oftentimes you don't have to reinvent the wheel. Somebody else already did that, and you just need to know, right? And we do this very intentionally because especially there's a lot of states that have staff, and like you go to Pennsylvania and they have in Philadelphia, right? You're a legislator there, you have staff in Philadelphia in your office, and you have an office in Harrisburg and it's fully staffed, right? But you go to New Mexico, you get elected in New Mexico, you're a volunteer legislator. You get zero compensation other than a per diem, right? And it's just you and your computer. That's it. There's no staff for you. And so trying to figure out how to legislate on all of these areas, right, is something that's where we come in. And so we use resolutions as the basis for then calling for legislation.
Okay. As I was listening to you all, one of the things that, everything resonated really, but one of the things that I like to encourage us to think about is our intersectionalities. Sometimes we think we have a certain image in our head when we think about Native American folks or when we think about Black folks. But the reality is that as someone that lives in that duality, I'm both Indigenous, Blacks, that I am a mutt. I like to encourage us to think about how we show up in our intersectionalities when we're voting or when we're advocating for certain issues, because just as I can advocate for the Latino community, I can also advocate for the Black community, and I can also advocate for Indigenous community needs. So as the election is away in 2, you say it again.
Yeah. But, yeah. No, but great point. And by the way, we do that in the Quad Caucus. We run resolutions sometimes at the behest of the other caucuses, right? So there's issues that are more specific to, say, the Native American community, the Black community, and so like sickle cell, right? And so we actually adopt resolutions where we're having conversations in the Hispanic caucus about something that impacts more disproportionately communities from the other caucuses. And in solidarity, then we push for that, right? So we break that silo, right? And we also, on occasion, actually meet together, right? So we're already thinking of, so next year in summer of next year, we'll be meeting as a Quad Caucus in Boston, for example, so that we can share these experiences and ideas as well, right? And that we can do this in solidarity, in real coalitions, because, you know, I always think of, like, just until recently in Pennsylvania, that has 1 million Latinos living there, until recently there was only one Latino legislator, right? So how can he champion issues on behalf of the Latino community? He has to build alliances. He has to educate Black legislators, Asian legislators, Native legislators, right? And so that he can then get something across the finish line, right? Or to be able to fight against a bill. Right, and so we do that, you know, very intentionally. So thank you for bringing that up.
I would also add that this goes back to data as well, because when I was doing all of my COVID vaccines, every single box I had to check was a select one for my race. And whenever you see that, then you are missing an entire population of people who might identify as more than one race. And that is why we need to change it right from the data collection standpoint. How can we tell the story about the intersectionality of people if we're not even able to collect the data accurately from the start? So it all goes back to the data again.